Hello, I'm Jennifer Rickert, the Vice President of Communications and Strategic Initiatives at New York Medical College. It is my pleasure to welcome you to this evening's webinar on summer camps. Due to the pandemic, many families are struggling with the decision as to whether or not to send their children to camp. And if they do attend camp, what measures to put in place to ensure their children have a positive experience and keep them safe. We are fortunate to be joined this evening by Dr. Robert Amler and Peter DeLucia, who will give us an overview of the current status of the virus, what measures the camps need to put in place to keep our children safe, what parents need to be mindful of, and strategies for maintaining a healthy environment. We have enabled the question and answer feature, so please type in any questions you may have for the speakers, and we will address as many as possible once the talk is concluded. Our first speaker this evening is Dr. Robert Amler. He is the Dean of New York Medical College's School of Health Sciences and Practice, as well as the Vice President of Government Affairs. He is also a practicing pediatrician, as well as a former regional health administrator at the U.S. Department of Health and Human Services, and a former medical epidemiologist at the CDC. And now, without further ado, I turn this presentation over to Dr. Amler.
Thank you, Jennifer, and good evening, everybody. It's a privilege to talk to you about an important topic this evening. And by the way, happy 1st of July. This really is summer camp season. And even though we know we are in the middle of a COVID outbreak, we want to figure out how we can get our kids, our families into that summer camp experience that makes so many permanent, wonderful memories for most of us going forward in our lives. So you can see the shape of the coronavirus. We're all getting to know this culprit, which spreads rapidly like a cold, but unfortunately, unlike a cold, it can kill people like Ebola does. It can cause terrible death to some people, particularly the older age groups and people with certain underlying medical conditions. So what about the young population? What about getting kids into camp where they can put this behind us, where families can maybe forget a little bit for a while about this outbreak and simply enjoy the summer? Well, couple things that we have worked on. First of all, from the beginning, we were all told to stay away from sick people. And here's the reason. It's all about defending against the sneeze. If you could actually see this instead of the special polarized light that was set up for this slide, if you could see this every time someone sneezes, you would keep your distance, no question. And that was the original recommendation. If someone's coughing or sneezing, stay away, get away from them, make them go home, tell them to stay home until they're better and their fever has gone away. But over time, it's turned out to be a bigger deal because people getting sick with documented COVID infection knew that they had never been near somebody like this in the last couple of weeks. So it became apparent that other people were walking around carrying the virus without symptoms, and many of them not even realizing that they were infected. So it became more of a question of not just defend against the obvious sneeze, but to wear masks, wash hands, and watch distance. All of them begin with a W. And my friend and colleague from the CDC, Dr. Tom Frieden, calls these the 3 Ws. Think about the beginning of a website address, www. Think about www. And that begins with this, wear masks. We've heard this, we've seen it, but it bears repeating, okay? On one side, on your left, you see an N95 mask, respirator. That is a special device. It's really intended primarily for healthcare personnel, people at high risk of exposure. It's difficult to wear. It's uncomfortable to wear. So you're going to be better off almost always with the mask on the right, which is a plain paper surgical mask, which has the function of keeping your exhaled breath out of the airspace you're walking through. It keeps it contained inside the mask so that you don't spread virus and droplets around yourself where others can inhale it and get sick. Now, so let's replace that N95 mask on the left with this cloth mask. A lot of people have bought these cloth masks. These are pretty much just like the paper masks, and they accomplish the same thing. If somebody is sneezing right in your face, are these going to protect you from that sneeze? Not really. But what they will do is protect others from your exhaled breath. And this seems to have made quite a difference in the New York area and in our surrounding states here in the Northeast, where people, by and large, have been careful about social distancing. What's the other W? The other W is wash hands. This is not a 21st century technology, is it? This is a 15th century, a Roman era technology. We've known for years and centuries that you need to wash hands. But let me demonstrate why it's so important. Now, here we have a volunteer who put some fluorescent material on her hand just before we took some pictures in ultraviolet light. Now, if you look up in the left, you can see before washing, she had this stuff that shows up white all over her hand. So the next thing she did was rinse her hand and shake. And that's number 2 in the middle top of the slide. You can see, well, she took a little bit off. But would you be comfortable with that if that white stuff was virus? I don't think so. Let's go on to number 3 in the upper right. That's 6 seconds washing, no soap. 6 seconds of wash, no soap. I don't know about you, but a lot of times if I'm in a hurry, I might just quickly rinse my hands for about 6 seconds, and I might or might not reach for the soap, if not for the current outbreak. So look at that. You've cleaned a little bit, but you haven't cleaned much. If we go down to 6 seconds, now this is now the lower left, and we go down to the 6 seconds with soap, look what a difference the soap made when you used it. Now, everybody panicked for a while about hand sanitizer, hand sanitizer, hand sanitizer. I'm running out of hand sanitizer. I can't buy it. Well, we still haven't run out of soap, have we? And soap is still pretty plentiful. So look in the lower middle box, the center lower box, 15 seconds with soap. This is looking pretty good. By the way, fingernail beds usually show up white on ultraviolet light, so ignore the fingernails. Just look at the hand. Most of that hand is now pretty clear, but not perfect. But by 30 seconds over in the lower right, you've got a really clean hand, and you're going to be okay. Now, the CDC and we recommend 20 seconds. We think that's usually good enough. So we ask you to count 20 seconds when you wash your hand. Well, what's the third W? Remember, it's watch your distance. Now, I don't know how many times you've been out there with a yardstick measuring 6 feet. It's not that easy. But if you outstretch your hand and the other person your arm, and the other person outstretches their arm, for most adults, you're pretty close now to 6 feet between your faces. And so that's a simple way to measure that distance. Why do we want that distance? Because a lot of droplets are heavy enough that they fall after they come out of your nose and mouth, and so they don't infect the other person. So here you have somebody who's got some coronavirus coming out on the right, and this person is saying 6 feet away. The other person looks like they're going to be okay. But I'm going to add a fourth W to my friend Dr. Tom Frieden's 3 Ws, and that is walk away. Even if you're at 6 feet, if you're near other people, there's no reason to stay around and linger for long periods of time, because the longer you rest in a particular area, the more likely it is, or the more opportunity there is, for viruses to reach you and get inhaled and infect you. Well, those are the basic principles of keeping yourself safe and your family from COVID-19 virus. But how do we actually get this done in a summer camp with all that goes on, with all the moving parts? And how do we do that in a way that's not just safe on the first day, but is safe for the whole camp season? We care deeply about this because we know how valuable a summer camp experience can be for many kids and families as well. So we're going to look at the CDC and what they recommend. And I know this slide is complicated and hard to read, but if you're a camp director, if you're a camp inspector, like our next speaker, this gives you at least an initial template for the things that you could look at. And these folks can read this in detail and go down these checklists and make sure they've got the bases covered. I should say also that as a country with 50 different states and the District of Columbia and some territories as well, that there will often be specific state guidelines that also have to be followed. If there's a discrepancy between the CDC and the state is preeminent. And so it's absolutely essential to make sure that if you're in New Jersey tonight or another state other than New York, you need to be knowledgeable about what's required outside of New York State. Well, if you want to go to this site yourself, here is the web address at the top in blue. I know you can't possibly see that or write it down, so I'm not going to ask you to do it, but I checked and this works. You could just type in the address bar CDC Camp. And if you type CDC Camp, it'll bring you to that gobbledygook up the top. So without further ado, it's my pleasure to introduce Mr. Pete DeLucia from the Westchester County Department of Health. Pete is known all over Westchester. He is well known all around New York State and the region. He makes frequent appearances on TV and radio when people have questions about practical public health issues, ranging from summer camps to water systems, sewer systems, restaurant inspections. All of these things fall under Mr. DeLucia's purview because he is the deputy commissioner for all of what are called environmental services. And by the way, if a child has lead exposure, if a child has exposure to a chemical or there's a bad smell in a neighborhood, typically it's Mr. DeLucia's unit that will lead the initial investigation and response and then refer it to the appropriate state or county agency. So it's really a thrill to include him here at New York Medical College this evening. Pete DeLucia, everybody. Pete, take it away.
Thank you, Dr. Ambler. My pleasure. What a fantastic introduction. Thank you so much. Well, summer camp. There is going to be summer camp this year for day camps in New York State. And I love the 3 W's and the 4th W that Dr. Ambler mentioned, because that's kind of part of the theme of opening summer camp. And as I discussed this evening, you'll see that theme throughout the rules and regulations that have been promulgated for summer camps to be able to safely operate. They're going to be wearing masks. We're going to have a lot of hand hygiene, and we're going to be keeping our distance. So all of those things are very important. So first and foremost, summer camp. We're used to it, kind of have this vision in our mind that we send our kids off there. We're putting them, the trust of our children now in the hands of these capable people, and they have all things to worry about swimming and activities from kickball to softball to baseball to soccer to archery to even sometimes firearms and things like that. But now we have COVID. So it threw a curveball into their whole plans that not only do they have to worry about the safety of the youth that they're now supervising, they have to worry about an additional portion of their safety, which is COVID-19, and being able to protect them to be able to safely have summer camp. So to kind of begin our normal journey to summer camp, it's drop off, whether you drop your child off at the camp or potentially your child is picked up by a bus. Right at that point, there are safety measures that are immediately put into play. These safety measures are called screening. So it's basically a group of questions that you're going to be asked as a parent. It'll have questions about travel. It'll have questions about contact with anybody that's been ill. And then it's going to have symptom questions. Does your child have any of these symptoms or have they experienced any of these symptoms? And there's going to be a temperature check. The temperature check can be done at home prior to, but at every camp, there will be a temperature check either before they get on that bus or when you drop them off before they're let into camp, because they're going to double check on that temperature, because that's very important. And along with that temperature, the temperature they're looking at is 100.4. So any child that's a temperature of 100.4 is not going to be allowed into camp. And that's very important. And we know everybody's very busy. Your people are back to work and all, and it's very important that they need childcare, but it's also very important that you cannot send a child to camp with a fever. Same thing during the regular academic year. So that's going to be pertinent. Along with that fever, like I said, there's going to be a screening tool with symptoms. If a child has a fever and any of the other boxes are checked off that are typical case study, case management of COVID, where you're going to have either potentially the cough, diarrhea, vomiting, there are a litany of different things there. If those boxes are checked off with a fever, what the camp's going to do is not notify everybody, but notify the Department of Health. And then you'll wind up getting a phone call from one of our fantastic public health nurses to kind of ask some questions and really to direct you that you should see a physician. Because at that point, there may be COVID testing that needs to be done, or, your child may have something else. I mean, we know that, during the summer, there are many different childhood illnesses that go around, which also could be spread at camp. And, you don't want to have that happen. So we want to be doing this diligently. You're going to be doing that temperature check. The camp's going to be doing a temperature check, and you might be getting a call from the health department depending on what's going on. So that's one of the tools we've worked with our camps to do at that drop-off, is to put together that screening. You may see it as just a form with check boxes. You may see some camps that are more advanced that are doing an online app, but still that temperature is going to be checked at camp. Then we've also worked with them for a flow chart. I think you'd be interested in knowing, what happens if someone has COVID at camp. So if in fact someone was at camp and the camp finds out the next day or a couple of days later that someone was at camp with COVID, our contact tracers are going to be involved, but there are precautions put in place around cohorts at camp so that that group that your child is in will be immediately contacted, will immediately have to go home. And if they were in that cohort where there was a COVID positive, there's going to be a 14-day quarantine. And there'll be follow-ups from the health department to make sure everybody's okay and to direct you on what to do. With the symptoms, if it's just symptoms of COVID and there's no positive, that group will be made aware, not the entire camp, and we're going to wait and see. And as long as everything's okay, it's most likely going to be a childhood disease. It'll be something else that's going on, a common cold, summertime, flu, something, and then everybody will be able to go back to business as usual. So that kind of leads me into the ease of contact tracing, like we said, because of these cohorts. One of the other regulations that was put into play is no more than 15 children can be together in a cohort. Now, this is ever changing. Up until a week or so ago, it was 10 children. So they made the decision to move this to 15 children in a group. So that doesn't include the counselors. So it could be 15 children and a minimum probably of 2 counselors at that point in time that will be with that group, and they will travel together to all the activities. So at this point, those groups are not to interact with the other groups. So it's going to be a cohort, the same counselors and the same group of campers together. Now, there might be an instance where a counselor needs to take a day off or something like that happens, and they will allow for a temporary fill-in counselor, but it's going to be regulated and it's not going to be something that happens on a routine basis. It would be for special occasions where we have that outsider that's in our cohort. But that cohort, for instance, will travel to arts and crafts together, will travel to the waterfront together, will use their own soccer ball or baseball and things like that, and there'll be sanitizing involved and things like that. Within that cohort, now we talk about one of our W's about wearing a mask. In that cohort, the children in that cohort do not need to wear masks. So when they're playing baseball, when they're in the pool, when they're doing arts and crafts, and they're together in their group, they do not need the mask. They may need to darn a mask when they're moving from group activity to group activity, if in fact they're going to be passing other areas, high traffic areas that might be going on in camp. The counselors are required to wear the masks. So for the most of the time, the counselors will be wearing the mask. If they take a break and they're over 6 to 10 feet away from the group, they can take that mask off for a moment. Remember, this is the outdoors. It's going to be it's still warm, hot environment. Depending on if it's late July and August. So there is an opportunity to relieve yourself and get a little air if they move away from the group. If they are involved in swimming, that is one location where if they're in the water or doing anything, they are not to wear their masks. The masks are going to actually pose more of a safety hazard having them on than the protection it would be by wearing them. And lifeguards also, to be aware if you're visiting the camp, lifeguards are not required to wear the masks when they're guarding. But that may be something different. You might not be able to visit camp. Those are some things that are very common over the years, that it's Parents' Day, Grandparents' Day, things like that. Don't be upset. But those are some of the regulations that camps are doing, just because, once again, the least amount of people involved in that camp, in that setting, the safer all the children are going to be. Same thing with drop-off. We go back to drop-off. I backtrack a little bit here, I'm sorry, but it may be a camp may ask you, please just have one parent involved in drop-off, so we have consistency there. Okay, it might make it a little more difficult for you, but there are rules that the camps may actually go above and beyond what we have legislated. But we recommend, once again, the minimal amount of people that are going into and breaking into those cohorts and involved with camp, the better. We want to keep this nice and safe. We want to keep it, like we say sometimes, there's a red, a yellow, and a green light. Right now, at the beginning at drop-off, it's that red light. Then we go into the yellow light, things are moving okay, and then we're in our cohort, we're green light. We can take over our masks and we can do these different activities. And then at the end of the day, when we're getting ready to go home, we maybe go back into that red light again. We want to make sure people are masked, people are in their groups appropriately, get in their cars, and they go home. So I think we went over all of that as far as the temperature checks and all, the cohorts and all. If we go with the activities that you're going to see at camp, most camps are going to try to have a full activity day. They're going to be traveling in these cohorts. They might have a guest that comes in, if there's a guest with animals or a magician or something. At that point, these cohorts may come together in a field or come together in a large building, but they're going to be still cohorted and not interacting. They're going to be kept, once again, with one of the W's, right? We're going to watch your distance. So they're going to have them at a distance apart and maybe more than 6 feet, because we know kids move around. It's very hard to keep them contained. So we're going to keep them at a distance. Same thing on a rainy day. You might have to go inside during a thunderstorm, depending on your camp. You could have multiple groups go indoors, but they're going to have to keep their distance and far enough away so they're not actually playing together, sadly. Now that may change down the road. There is some discussion as we move into the summer, depending on how things look. There might come an opportunity where some of the camps, some of the groups may be able to play in a very low risk activity. Low-risk activities are defined on the New York State Forward website. There's a recreational guidance that's out there. But low-risk activities are things like, a court sport where each group is on a different side of a court and you're playing tennis or badminton. Things like that are low-risk activities. And you'll be able to sanitize, the ball or the racket or the things before another group uses it. And that's something else with the cohorting going to each activity. Arts and crafts, they will have their own arts and crafts box, that group. They won't be sharing an arts and crafts box. So the scissors, the tape, all that will be separated for, the group 1, group 2, and group 3. The contact that may happen, and you'll sign off on this with each camp if they have swimming, the contact's going to be for learn to swim. Learn to swim, swim lessons in swimming has been deemed an essential service by the governor's office, and that does make sense, because I've spoke about this on many webinars and on TV numerous times about how dangerous the waterfront is, whether it's at camp, whether it's at a regulated pool, or extremely dangerous when you're looking at your backyard pools or unregulated lakes and beaches. How the only way really to work towards drown-proofing a child is really to teach them to swim. Little swimmies and floats and things like that are all things that can get people in trouble. So the best thing to do is learn to swim. And one of the greatest places to learn to swim is at our children's camps throughout New York State and in Westchester County. We've got some fantastic instructors, but to be able to teach swimming, it is a very close hands-on instruction, especially with the little ones. So that's something where you as a parent, if you decide against that, you can let your camp know that that's something you don't want to have happen, but they will be letting you know about the swimming and being at the waterfront. Another big difference this year, and it actually plays into the waterfront, is the grouping of the kids with friends. I want to have Peter with Rob Amler. We've been best friends for years. We put on our camp thing that Pete's with Rob, and Rob puts that, his mom puts that, Rob's going to be with Pete. It's very common. That is not necessarily going to be something that's going to be able to be honored this year by some camps, especially those that swim. Because while maybe I don't know how to swim, Rob may be classified as a swimmer. So in that case, it would be very difficult for us to be in the same group and go to the waterfront, because once again, we can't mix cohorts anymore at the waterfront, where we put our swimmers together, our non-swimmers together, we do our buddy check. Non-swimmers are required by code to be limited to chest deep water unless they're in learn to swim, where the swimmers are allowed to go in water that's over chest deep. And there's something also required called the buddy check. The buddy check is so important that you get buddied with another camper of the same swimming ability. Not similar, not different, the same swimming ability. So that's what's very important. So you may be in a position where what camps are going to be doing, they're required to evaluate their swimmers, as they always have been. They're going to do that right at the beginning of camp. Or if they know that you've been evaluated last year, they're probably going to be making their groups by swim ability, so that doesn't interfere with the ability to the kids to be able to have an enjoyable swimming session, be able to go swim, and still be protected under the COVID guidelines of the grouping. Those are some very important things there. Another thing is anytime you want to take a look and see what's out there, because as I said, it's an ever-changing and evolving rules and regulations set right now, because we still don't know everything about the disease. We're still not sure about how things can operate. So as we might pull things back or may allow for a little more. So on the New York State Forward website, if you live in New York State, and as Dr. Amler so eloquently said, it really depends state to state. You may see something happening right next door. If you're in New York, you see something happening right next door in Connecticut. Oh, why can't that happen in New York? There may be reasons for that, and what the numbers that we're at and things like that. So you want to look at your state website. In New York State, you can look at the New York Forward website, take a look at the children's camps and the recreation guidelines, and all that important information is in there. I want to say, as we talk about these rules and regulations, what Westchester County does and what New York State does every summer, not anything different than this summer, is we review the children's camp safety plans before they're allowed to open. So there's a whole document that every year gets sent to my inspectors. They sit down and they review it regarding medical, regarding lightning, regarding recreation. There are background checks that need to be submitted for the staff, for the counselors. They go through the Department of Social Services website to make sure that the people that work there don't have any blemishes on their record involving whether it's sexual deviancy or abuse deviancy or anything like that. All those things are something that get fleshed out, reference checks, all of these things. And then once that plan is approved, then the camp is issued a permit. But that's not where it ends. Our inspectors go out during the summer and do unannounced, not announced, unannounced surprise inspections. They may do multiple unannounced surprise inspections, especially at those camps that have waterfronts. We inspect every camp, but if the camp swims, we do 2 swimming inspections, unannounced, to go there and see that the buddy check is happening, their swimmability has been evaluated, and all of the things that are code requirements for our lifeguard certifications, our water quality, all of that's all being done, along with the full inspection of the camp, whether it's a camp at a municipality or a camp that's a private camp, they all get the same inspection. And if violations are noted, another inspection happens. Depending on the significance of those violations, a ticket might be issued. Notification may go back to the parents to let them know that this happened, but a reinspection will be done to make sure those violations have been corrected. And if it's a violation at a critical area like the waterfront might actually be closed until they can prove that they operate that waterfront in accordance with the code and with the safety, because it's all about the safety of the kids. And with the COVID regulations, the same thing's going to happen. We're going to be checking, surprise inspection and seeing that those logs are being kept, the temperature checks are being done, and they're actually monitoring to make sure that the groups are staying together, the mask usage, sanitizing stations throughout camps, because that other W that I didn't touch upon as much as Dr. Amler was the washing of your hands. So whether it's with hand sanitizer that'll be provided at the camp that will make sure it's a proper alcohol base, depending on what kind of sanitizer it is, and hand wash stations to wash with soap. and have paper towels to dry those hands, because the slides that Dr. Amler showed us are, they are telltale and they tell it all. And I talk about this all the time. If there's one thing in public health that's so important, is your hands. These are the biggest spreader of viruses and bacteria that are out there, and not properly doing hand hygiene and touching your face and then going to eat and touching your mouth, this is what makes you sick. So the more often hand washing, and I'm also a big paper towel fan. When you take a look at those slides that Dr. Amler showed you of 10 seconds, 15 seconds, and you want to be thoroughly washing the hands, and then you wind up, going to one of these high-speed dryers, and I don't know anybody that keeps their hands underneath there long enough, and they wipe them on their pants. If you saw me standing up, now I just destroyed everything I did with that hand washing. But if I have a paper towel, and maybe I go back to one of those slides where I didn't do the greatest job washing my hands because I was a little quick, and I dry with a paper towel, guess what? The science has showed that some more of that bacteria and viral load goes on that paper towel and in the garbage. It also lets me use that paper towel to shut off the faucets and maybe open the door. Now we're talking about kids, so I don't expect them to be that great with hand hygiene, but if they learned anything out of this experience, maybe they're gonna learn about being a little more conscientious and using that alcohol-based hand sanitizer as much as possible when they go out of that porta potty, or when they're done with arts and crafts and they grab their sandwich. So those are very important things. We're going to be making sure that they have those stations around there. So we're going to be there. We're going to be out there. And I want to touch on a couple more things before closing, is the importance of going to a regulated facility and signing your child up for a regulated camp. There are many camps that we're seeing now, and some of them are just babysitting, but they're calling them camps on Facebook, on Craigslist, on Instagram, and I understand. Not as many camps open this year. Certain jobs aren't available. So you've got a lot of great, young people that are looking for employment, and they're deciding, you know what, I could do something in my backyard. I've got a beautiful pool in my backyard. I'm lucky enough to have an acre of property or whatever it might be. And I've got some friends that are also lifeguards. Let's run a little camp in the backyard. This will be great. We'll get 10 kids, whatever. No, it's not. You can't do that. So any of these you see, they're either should be regulated by us, or they need to be regulated by the Office of Children and Family Services, by the state. And why is that? Because backyards are not meant to be camps. Because the pools that are in these backyards are not inspected by inspectors. All the pools that are municipal and at camps are inspected by my department to make sure that they comply with a litany of violations, including something you may have heard about called the Virginia Graham-Baker Act, which is a special drain cover that has to be on any intake, whether it's at the bottom of the pool or the side of the pool, so that you can't get trapped. Hair gets trapped in that, you get sucked underwater, and there's such a suction, you can't rescue the person, and the person dies. Kids like to swim down and touch the bottom of a drain, they get stuck on the drain and get disemboweled. These are things that have happened. And backyard pools, depending on when they were built, they get built years ago, they don't get another CO inspection. So they might not have that kind of protection. They're not also checked for pool chemistry. The backyard has so many other things that aren't checked, whether it be for insect control, whether it be for the playground set, trampoline safety. The counselors are not vetted. There's no background checks that I talked about. There's no predator checks. There's nothing like this. And the zoning in a municipality is not there. The insurance, the person's homeowner insurance doesn't cover running a camp in their backyard. So these are all problems, both for the person that thinks it's a great idea to run the camp and for the people that send their camp there thinking that their child is safe. So it doesn't matter the amount of kids. What happens is if it's a small amount of kids, it's regulated by daycare. It's considered a daycare. If it's 10 or more kids, it should be regulated by us. And that in no means does not allow for babysitting. The one-offs or a couple of times a week or something like that your son or daughter may be babysitting at the house, or you send your child over somewhere that you typically do, that's babysitting. But when it becomes organized group activity on a routine basis, that basically all under 1 and 2 regulatory agencies. So you really want to be sure the camps out there that are going to be open this year are working very hard to make sure that they've done the best they can do and are ready to actually be able to have children come in and protect your child and be as safe as humanly possible. So I know all these operators, I've met them over the years. They really work very hard to do this. And a lot of them aren't open yet. Camps usually open, the 3rd week of June. A lot of camps aren't open yet, not because they weren't allowed to open near the end of June when the governor put the order out. It's because they want to be prepared. They want to have their T's crossed and their I's dotted to protect your children. So some of them I know just are opening now, coming up, I think, on Monday, probably. Last Monday, it's July 1st already. I can't believe it. But many of them are opening next week after July 4th so that they were able to prepare and be able to make sure they had everything right. So I know it's 6:36 right now. I hope I didn't go too long. I think I was supposed to go somewhere in this ballpark, or I think I covered many of the things that I wanted to cover right now. And I know there's probably a lot of questions out there. I could talk forever. We can keep going. I enjoy it. I think it's a great topic. And I think, once again, it's just so important that you do your research. One more thing about the camps, as far as knowing, you can take a look. If you see online a camp you want to go to or whatever, ask them for their permit. Ask them if they have a permit with the Westchester County Health Department. If it's in Sullivan County, ask them if they have a permit with the Sullivan County Health Department or with the New York State Health Department. That's what you want to make sure. And if you ever have a doubt, give a call to your local health department. If you're in Westchester, you can call 864 73. Well, I can't even think of my number right now. You can call 864-7355. That's my direct line. Or you can call the main health department, which is 813-5000. That's our main number, 914-813-5000. And you can give that number a call, and you can get to one of my inspectors, and we will look that camp up. And if it's not a registered camp, we will look into that camp and find out what's going on. So that being said, I will leave it over to Dr. Ambler or to Jennifer, if Jennifer is going to be moderating some questions for Dr. Ambler and I.
Thank you so much, Dr. Ambler and Peter. That was extremely informative. To just expand on that point a little bit, someone had written in, is there a website that you can visit to see which camps have been inspected and are certified, or should you just call directly? And is there also a way to look at prior inspections from previous years to see how they've done in the past?
It's a great question. As far as food goes, yes, there's a website you can go on. New York State has a website. There's a link from our Westchester County website to go and look at food inspections. At this point, at least in Westchester, I don't believe our camp inspections are online. That doesn't mean you can't have access to them. You can give us a call. We can check into that camp, and then it's called something a freedom of information request. You can make a FOIL request very, very easily. You can shoot an email right online. If you go to our Westchester Health Department website, so www.westchestergov.com, you can see the website behind me, and you can go to departments and click on health, and then you can go right there, and there is a button where you can submit a FOIL request, and we will take a look and give you what you want. You can say, if you're very interested in Cam Mohawk, can you please send us the last couple of inspections, and we can do that. We can get that for you.
Okay, another question that came in is, will it be required for counselors and campers to get tested for COVID before they go to camp?
We are not requiring that. Your camp may require that. I'm seeing that more and more with different, private schools right now. I've been talking to a couple of private schools, and that's what they're planning on doing. They're actually planning on doing asking the parents to do a 14-day confinement before school, 7 days before school, do a COVID test, and then they're going to do a test at school. I haven't seen that for camps yet, but depending, some of the bigger private camps that may have the ability to do that may require that. Probably the municipal camps, I don't think they have the capacity to do that. Clearly though, right now it is not a requirement. Testing's not.
And I would just add, for these kinds of requirements, always check and see what's current. Until just a few days ago, you could travel from any state into New York without a problem. Now suddenly we have a dozen or more states where you are quarantined if you arrive here from those states. So this is an evolving situation, and the guidelines will also change as the reality changes on the ground.
And that's why it's so important to make sure you go to a reputable licensed facility. You want to do that. So they will be right up front and letting you know that, okay, this changed now. As of Wednesday, we're going to be doing COVID tests because Governor Cuomo has required that, and we've seen that that's a necessity. So that can happen. But remember, the W's that we've gone over today are very important. Those are going to be the things that are going to help protect all of us, whether it's at camp, whether it's at the restaurant, whether it's shopping and things like that, to have that respect. And the mask wearing is really a matter of respect for your fellow, your fellow person, because, it's really protecting them against you. And Dr. Ambler said that very clearly. Those N95 masks, technically when my staff wear them and I wear them, we've had to go through a medical clearance to be able to wear that mask. Because it does interfere with with the way you respire. It takes a lot more to breathe with that mask on, and those are the only masks that really give you, the most protection that you can get against someone actually sneezing at you. These other masks, whether it's a cloth mask or the surgical mask that were in the slides, those are protecting other people from you. You're probably getting some protection, but you're really protecting other people. So if everybody's wearing it within that proximity and you're keeping your distance, and I think, as Dr. Ramble eloquently said, it's working in New York, that's the way to go.
Another question about masks, just to elaborate on that, is how many masks should you send in with your child? Is one enough? Should you send in multiple masks or multiple changes of clothes for sanitation? What do you recommend?
Depends on the age of the child, and you know your child better than the camp. Is your child prone to, like my daughter, leaving things all over the place for everybody else to clean up and find them? Or more like my son, who's a little better with keeping an eye on what he has? Masks, the surgical type, will get dirty. We always say, the 3 Ds of mask wearing: damp, dirty, or destroyed. Those are the times you need to change them. So with a child, they can get damp, dirty, and destroyed probably pretty quickly. Camps, talk to your camp, find out the supply of masks that they have, so that if your child's mask actually gets damp, dirty, or destroyed, they're going to be able to provide another mask for the child or for the counselor, because a lot of the parents are concerned about their children working as counselors at these facilities. The fabric masks can be washed. So I would say with those fabric masks, every day or two, depending on what kind of condition they look at, or even on a daily basis, throw them in a washing machine, give them a quick wash, or have a couple of them and rotate through the fabric ones. That's my best advice. But check what the camp has on supply and how they're going to work that with you, so you know in advance what kind of supply of masks you need to have. But I think for camp, the fabric ones are probably better. The paper ones are going to get wet. And then remember, they can put them in their pocket, because most of the time in the cohort, the kids aren't going to be wearing the masks. So I could see them losing them. I could see them at swim, and, maybe have a way where, maybe you should come up with a mask that has a little clip that'll clip onto your shorts or something. I don't know. Maybe we can all come up and have a great idea with a little better way of maintaining the masks.
Okay, the next question is about sleepaway camps. We made it clear that there'll only be day camps in New York, but there are sleepaway camps that are open in other states. So what are your thoughts about safety, sending your kid to a different state to do a sleepaway camp?
I'll go first, and then I'll let the good doctor weigh in to see if I'm right or wrong. I think, in a way, sleepaway camps, as long as they keep them there, and I'd like to see the testing beforehand, I think you've got a great cohort. If you can keep them at the camp, just kind of like what the private school model right now that a lot of them are doing for school. Once you get there, basically you're quarantined. This is the group. You're here for your session. You've been tested. We made sure you were negative, and you're in. If they're going to, have color war against, Camp Mohawk across the lake, and we're Camp Iroquois, and I don't know what's going on at Camp Mohawk, once we start mixing those cohorts and things happening, it's not as safe. I would look in to see how they're going to provide consistency and monitoring at that camp.
And I basically agree. Realize that for any sleepaway situation, at a minimum, you're going to want, as a parent, to inspect and ask and inquire, first of all, are all of the things that we said about day camp, are those going to be taken care of? Everything from distancing to checking temperatures periodically, all of the safety checks and background checks on the staff, where they're coming from. There was a situation a few years ago in a summer camp in a different county, not Westchester, but very close to where we are right now, in which almost the entire camp staff was from another country. And they were lacking in immunizations against some of the common childhood diseases. And in fact, they had an outbreak. I believe it was mumps, and I think actually Pete remembers that one because it was near Westchester. But, you know, as a parent, you're going to want to ask all those same questions. What are you doing to protect my child and to protect the safety and continuity of operations in the camp?
Another question that came in is younger children often have trouble maybe keeping a mask on if that's required or maintaining social distancing. They may run away from their cohort to another group. Do you have any recommendations about the age that children should be attending camp? Do you think there's a cutoff where you just feel at this time, maybe at a certain age, it shouldn't be open to children?
Well, that's a great question. I guess as the pediatrician at the table, I should field it first. And look, you have to know your child. Nobody knows their child better than the parent. And you need to really think to yourself. Now, typically with school-age children, they've already been through the drill, haven't they? I mean, they've already learned about masks and distancing and all of these things. And they've also had to they had to sit through a lot of pent-up difficult times trying to learn online and so forth. When they get into camp, it's going to be just like when you take them shopping or any other place. They've got to be careful. And again, if they're school-age children, they can learn this just as well as we've learned it. And as a parent, you're going to drill them and make sure that they know and that they know what to do. Now, for the preschool-age child, again, speaking as a pediatrician, this is going to be more complicated. You need to really know your child. I've known 3- and 4-year-olds who are very good at following directions. They're very focused, they're very serious, and they'll do what they need to do. And they won't go running off to other places. But children are children, and little children will sometimes lose it. They'll have tantrums. They'll take the mask off and throw it on the ground and stomp on it and so forth. I've known plenty of older preschool-age children who can't really follow directions. They're maybe not that level of maturity, or you'll have sometimes a cohort of some special needs children who simply are going to have to be worked with much more closely and intensely. So for the younger child or for a child you're just not sure of, you're going to want to talk even more closely with the camp staff and the camp management to understand how are they going to give your child a worthwhile camp experience while still protecting her or his safety.
And we actually got another question that came in about special needs camps, and they asked you to elaborate a little on that. For an autistic child or a child with developmental disabilities, summer camps are often very important. What is your advice to a parent about these types of camps?
In Westchester County and in New York State, there is a code that requires additional support with those camps as far as requirements for counselors and things like that. And the camps that we've had in Westchester, I think Northeast Recreation, or I forget the exact name of it, but they've done a fantastic job. And that's just, in general without the COVID requirements. So they are specialized camps. You want to make sure you're sending your child, especially at this time, to one of these specialized camps, because they will, be able to handle what they've normally handled and then integrate the COVID requirements in there. And it's smaller groups, one-on-one instruction, a lot of things like that. So that's very important. And as Dr. Ambler said regarding the last question, I couldn't have said it any better. You know your child and get to know the camp. If you're concerned about that, make sure you have a discussion with the director, and then possibly who's going to be the head counselor involved with your child's group, or how's that group going to be arranged to make sure that it's going to work for you, and to make sure you're satisfied, you feel comfortable, and your child has a good camp experience. One thing we didn't touch on in general also is, remember, all the other requirements are still there. So the camps have to make sure that they fulfill that, and you got to make sure you fulfill your duties also. So when Dr. Ambler mentioned about the one camp that didn't have the proper immunizations, that made me remember, make sure you consult with your pediatrician and get your child's most current chart with all those immunizations, because that's required for the camp to have that. So if something happens, they know who may not be properly immunized against whatever else might happen at camp, to make sure that those people are excluded right away, and the right thing can be done. And and you still have to, if you need to get updated immunizations and everything, the pediatrician's offices are open now. If you're able to, and you're going to send your kid to camp, you should make that appointment and go to your pediatrician to make sure that your child is up to date with everything he or she needs to have.
And I would just echo that and say that particularly for children with special needs, they may also be especially vulnerable to certain infectious diseases, either because of their underlying ability to fight infection is impaired, or very simply some behavioral aspects of their illness means that they touch things more, they pick up dirt and touch it and put it in their mouth and so forth, things that other children may not do. It puts them at risk of infection. All these children are special and they deserve special attention, but realize that they can also be especially vulnerable to catching infection because of their inability to control putting things in their mouth or in their face. So make sure, if the child can be safely vaccinated, make sure they get all the vaccines that are safe for them, and just steer clear of the ones that your healthcare provider advises against. Make sure every vaccine that's possible is given to your child.
Another question that came in is, can you explain why day camps are allowed to be open and sleepaway camps are not?
That's a great question. I think as the review at the governor's level and at the state health department level, they made this decision based on metrics on what they figured as far as the ability to be able to have, I think, all these different kids from multiple areas and other states and all going and congregating. I think just like what we mentioned earlier, right now, keep an eye on what's going on with interstate travel right now. If you travel to another state and come back into New York, or you're coming from New York from one of these travel ban states, or I won't say travel ban, but quarantine states where you're going to have to be quarantined for 14 days, many overnight camps support that population of kids coming from other states. So I would think that that's part of the decision-making process. Now, I was not part of that process at all. I'm not privy to any special information, but that would be my inclination. I think they were trying to think of keeping it more local into those regions. As the regions open and you have camp, it's a more localized type of scenario. I don't know, from the medical side of it.
Yeah, I agree. The simple answer would be because the governor said so, or because the state health commissioner said so. But we need to understand, in fairness to our governor, that New York has suffered a terrible toll of death. Over 30,000 New York families have lost a family member just in the last 90 days or so. And this is a terrible burden. It's a terrible burden of responsibility on the governor and his people to decide how far can we go in reopening, giving kids the summer experience that they long for, and giving parents a break as well, let's face it. But I think that Pete's observation that summer camps, overnight camps, draw in children from a wider geographic area. Day camps tend to be a little more localized. And I would simply say, again, not myself either having been part of that decision, it probably came down to a matter of just a level of comfort and control that at this level we could reasonably say that the public will be safe, and not quite as comfortable in saying that we could do that with sleepover camps. Now, if you're in another state that's hundreds of miles away and you have a different level of disease in your state, as many states did until recently, you could come to different conclusions. So That's, again, why every one of the 50 states has ended up pretty much making its own guidelines, even though they're all flowing in pretty much the same direction from a medical point of view.
Yeah, and many of those states, I think Maine may be one of them, that I think it limited to their own state residents only for overnight camp. I think Maine was one of the ones that came out with overnight camp. So that's also another thing, exactly, depending on their rate and what they made a decision on, and you know what, we're keeping it to our state. So yeah, it's not an easy decision, and we understand as regulators and as public health professionals that there's sometimes a little bit of a balancing act here of mental health along with your physical well-being when you're cooped up for this period of time. So, you know, I'm happy that children's camp open, but I'm nervous that children's camp open, and we just want to make sure we do it right. So if we work as a team, remember, don't work against your camp, work with your camp, work with the camp operator. It's a team effort. I always say that with lifeguarding and with going to the pool. The lifeguard's not a babysitter. They have a job to do and watch the pool. So you shouldn't blame the pool facility or the lifeguard for not watching your child on the side of the pool or when they're running around and getting in trouble. You have a parental responsibility there. Same thing with camp now. Work as a team and work together so that we can have a safe and healthy summer.
Okay, our final question this evening is, what are your recommendations regarding how children are seated on camp buses to maximize safety and social distancing?
Buses are going to be a tricky one. We've been talking about that. Whether they're skipping seats, that's an important thing. We're doing the masking on the bus. The seating is going to be skipping the seats. Remember, in restaurants, they're allowing for a 5-foot barrier from ground up, and you can have booths going and things like that. So as long as we're not turned, looking at each other, coughing at each other, keeping our cohorts as much together, because they're together in camp. If the busing can work, what they're going to try to do is do cohorted busing. That's going to be a good thing. And if your child is favorable to wearing the mask, I would say the masking is very important on the bus. So we're back to those W's, right? The keeping the distance, wearing the mask, watching your distance, and then, hand hygiene. When they get off that bus, they shouldn't be running in the house now and grabbing some snacks and boom, boom, boom in the mouth. They should be getting off the bus and you squirting some hand sanitizer in their hand, or them giving themselves a good hand wash before now they have their snack before dinner.
Any final thoughts before we conclude?
I'd like to, first of all, thank Pete DeLucia, who's already worked a very long day. It began sometime in January, and it hasn't stopped. The health department, I can tell you from personal knowledge, these folks they've been working 7 days a week, long days, and they're doing this all to protect the 1 million residents in Westchester and probably another 500,000 guests and visitors who come into our county at various times. I would simply end by saying, for all of the questions that I've been fielding with the press and the media, with just Slate that interviewed me this afternoon, is remember that the whole defense against this virus is blocking the exposure. In all situations, if you can figure out how to block exposure to the virus, blocking exposure means no infection, and with no infection, there's no risk. So let me say it one more time just to close. No exposure means no infection, and that means no risk. It's complicated, but it's also as simple as that. It gets complicated because we're trying to prevent exposure in all these different scenarios. Our world has a million moving parts, and people go to and fro. But if you can prevent yourself from getting exposed, keep your children from getting exposed, they're going to be okay. So we're all going to be all right in the long run, and we'll be prepared. If this thing surges again in the fall, we'll know much better than we did last winter how to deal with it, and we'll be better set up to do that. So we appreciate everybody being on this, and I think that Jennifer Rickert may have some closing remarks as well.
I just want to thank both of you for your time, for your expertise. This is such an important topic. So many parents, and we're struggling with these decisions. And we just appreciate you giving us all of your sage advice. And we want to thank everyone for tuning in. And we hope to see you at our next Meet the Doctors event. Thank you so much.
Bye.
Thank you, everybody.
See you next time.